It's a great honor and privilege to be here and to share with you some of the newer concepts and actually take you to the frontiers of neuroscience in terms of the activities that are going on in terms of brain modulation with electrical activity. I'm going to share with you an overview of some of the developments over the past 150 years and some of the anecdotal stories that I think are quite interesting that really speaks to the future of medicine, as Dr. Klatz and Dr. Goldman alluded to as well. And I'm going to speak to you about newer approaches to movement disorders, to the attempts to control emotions, to the attempts to control such things as depression with electrical modulation of the human brain. Now, why is this important? All of us know patients with Parkinson's disease, essential tremor, patients who are overweight. 60% of the American population are overweight or obese, and also depression, which is one of the most common disorders in all of our practice. 10% of the population at some time goes through a major depressive episode. 20% of these are refractory to all therapy. So this does have some relevance to your own practice. The brain, the last frontier, when you look at these two slides, the human brain has over 100 billion transistors, or neurons. This number is comparable to the number of stars in our Milky Way. I like to think of it as the macrocosm of outer space, reflecting the inner microcosm of what we carry around in our own brains. 3-pound organ, the most complex organ in the world, 20% of our total utilization of energy and oxygen. And what is electrical neuromodulation? Essentially, it's electrical stimulation of the brain to reset or resynchronize various circuits that we now know are absolutely essential to how we move, how we feel, and how we think. And one of the most fascinating stories to me happened in 1848 to Phineas Gage. Many of you have heard this story. Phineas Gage was a very conservative, conscientious foreman on the Trans-Canadian Railroad, tamping an explosive charge into a rock to explode it. When the charge went off and projected this 3-foot-long projectile through his cheek, through the brain, and landed 100 feet away, splattered with his frontal lobe and cortex. The amazing thing was not that Phineas Gage lived. The amazing thing that his personality completely changed. He became, from a conscientious Christian individual in control, to very loud, profane, obnoxious, and irresponsible. At that time, in 1848, we had no idea about localization within the human brain. We didn't know that the frontocortical circuits were involved with executive function and with inhibition of our normal activities. We didn't know that the cortex controlled the opposite side of the body. If we had this high-definition fiber tractography image that we now are using routinely at the University of Pittsburgh to analyze athletes with traumatic brain injury, we could see that the circuits, that the wires, the connections from the cortex to the subthalamic areas were disrupted, that led to this obnoxious, profane, and irresponsible conduction of his behavior. But it really was 22 years later on the dressing table of Frau Hitzig in Germany when 2 German scientists did a craniectomy on a dog, and using the electrical stimulation of Morgagni stimulated the left frontal cortex and saw that the right leg moved of the animal.